Welcome back to the series on self-help acupressure. Today we will be talking on a very common entity, and that is headache. Now, pain is an unpleasant symptom calling for medical assistance. It is often exaggerated by tension and fatigue. Scientifically, acupuncture or acupressure is known to block transmission of pain impulses by closing the gates of pain signaling mechanisms and also by releasing pain reducing neurotransmitters in the form of endorphins. Now, head pain or headache due to tension is one such entity which can be treated effectively with acupressure. Acupressure can address headache due to primary causes such as tension, cluster headache, and migraine. However, headaches due to secondary causes such as intracranial tumors and bleeding and infection require treatment of the basic cause. Since all headaches in 80% of the population are due to tension headache, it is worthwhile attempting to treat this symptom by acupressure as the first try. For any headache, apply pressure on the large intestine 4 point. Now, this point, apart from headache, should always be used for pain anywhere in the body. LI4, as described in the earlier videos, is located in the webbing between the thumb and index finger at the highest spot of the muscle when the thumb and index finger are brought close together. First, apply pressure on the left hand for 1 minute and then switch hands to press the LI4 point on the right hand for another minute. There is generally a dramatic relief if it is just a simple headache. However, if there is associated neck pain and stiffness, then 2 additional points, namely GB20 and GB21, need to be incorporated in the schedule. After LI4, apply pressure on GB20 and 21, one after another. For GB20, place your thumbs underneath the base of your skull in the hollows that lie about 3 inches apart. Apply firm pressure gradually underneath the base of your skull as you slowly tilt your head back and continue the pressure for at least a minute. Now press GB21, which is located on the highest point of the shoulder. Apply pressure for 1 minute by using the index or middle fingers on both the sides. There are instances when headaches are associated with eye strain. In such situations, along with LI4, press the extraordinary point HN3. This extraordinary point is located in the midline on the face between your eyebrows, in the indentation where the bridge of the nose meets the forehead. Use the third finger of your right hand to apply pressure here for 1 full minute. Close your eyes slowly, tilting your head back, and breathe deeply while applying pressure. One could also pinch the bridge of the nose to achieve the same effect. At times, there is difficulty in sleeping due to a headache. In such instances, after pressure on LI4, apply pressure over GB16. Utilize both thumbs to apply pressure on GB16, which is located in the hollow below the base of the skull in the midline. Sinus headaches occur when fluids in the sinuses around your nose are unable to drain. Pressure builds up in the sinus cavities and this results in headaches. Along with LI4, use bladder 2 and stomach 3 to help in drainage of these sinuses. Pinch the medial end of the eyebrows on both sides using the thumb and index finger of both the hands. This helps to stimulate bladder 2 for frontal sinuses. Next, use your middle and index fingers of both hands to gently press up underneath the cheekbones, directly below the center of your eyes. This will stimulate stomach 3 for the maxillary sinus. Headache with hangover is not uncommon after a few drinks during the previous night. To manage such types of headache, apply pressure on LI4, UB2 and liver 3 for 30 seconds each. Liver 3 is located on the dorsum of the foot between the metatarsal bones of the big toe and second toe. This can be stimulated by pressure application on top of the foot in the valley seen between the big toe and the second toe. The procedures can be repeated 2-3 times with 15 to 20 minute intervals. Migraine headaches involve intense pain, mostly one-sided, and are often accompanied by nausea and visual disorders. Acupressure can be an effective complementary treatment to treat the pain of migraine. Apart from LI4 and EXHN3 already described, two more potent points require to be used. One is on the top of the foot in the groove between the bones of the second and third toes, that is stomach 44, and the other 3 fingers above the wrist crease on the forearm in the middle, namely pericardial 6. Both these points should be tried. Application of pressure for 30 seconds at each of the above mentioned points may help to avert the symptoms. Repeat the procedure 2 to 3 times a day. The same points can be stimulated whenever there is an impending attack or aura. Cluster headaches or trigeminal neuralgias are usually unilateral, abrupt, and excruciating with tearing, eye congestion, and facial sweating. Large intestine 4 and urinary bladder 2 should be used for all cases. Since pain distribution could vary, points to be selected are based on the region affected. For supraorbital or forehead pain, apply pressure on GB14. This is located about an inch above the eyebrow, vertically above the pupil. For pain over the temporal region, press small intestine 19, which is just in front of the tragus. For pain over the mandibular region, stimulate stomach 6 and 7 by applying pressure over the clenched masseter muscle. Lastly, a few words about headaches associated with toothache. For toothache from the upper jaw, along with large intestine 4, press stomach 2 and 3 by using your middle and index fingers to gently press up underneath the cheekbone. For the lower jaw teeth, apart from large intestine 4, stimulate stomach 6 and 7 by pressing with the fingertips of the second, third, and fourth fingers over the prominence over the masseter muscle when the teeth are clenched. Apply pressure at each point for 30 seconds and repeat 2 to 3 times in a day if required to tide over the crisis before obtaining a dental appointment. Thank you for your patient hearing. Do subscribe for getting an intimation for future videos.